Welcome to the Health Flow Podcast. I'm your host, Jean Armand. Join me weekly as I share health information that will educate and inspire you. Please consider supporting this podcast by listening, subscribing, and rating. You can also support future episodes by making small monthly donations. Once again, welcome to the Health Flow Podcast. Are you thinking about starting your own podcast? If so, Anchor is the easiest way to make a podcast. Let me explain. Number one, Anchor is free. Anchor has all the creation tools that allow you to record your podcast and edit it right from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcasts, Google Podcasts, and many more. You can make money from your podcast with no minimum listenership. Anchor is everything you need to make a podcast in one place. Download the free Anchor app or go to anchor.fm to get started. Welcome to episode 30 of the Health Flow Podcast. I'm so excited to have my longtime friend, Mrs. Lisa Wigfall-Parker. Hey, Lisa, welcome to the Health Flow Podcast.
Hey, sister friend. Oh my goodness. I'm so glad to be here with you and feel so proud and honored.
Oh, girl, I have to tell everybody about our how long our friendship's been. We met
Woo.
in college. We were at Seton Hall University in the nursing program. That's how we met. And we both lived on campus. And it's been a friendship made in heaven since.
Ever since, this is the girl who had to have breakfast every morning.
And still, you remind me of that. I still love breakfast. That's my favorite meal of the day.
If nobody else was in the cafeteria, Jean was in the cafeteria having breakfast.
Before clinical.
And we had to be wherever we had to be at 7 o'clock. So
yes. That felt like, we didn't have time to eat lunch.
No, right.
We weren't guaranteed time for breakfast when we got to, whatever clinical site we were going to be that day.
Right. And by the time we got back, we'd have to wait till dinner.
Exactly. So I just look. Money was tight in college. We were broke college.
We were broke, but the Lord blessed you with a car.
Oh my gosh. Yes. Dad got me a car so I can drive to clinicals because they weren't around the corner. And I mean, it was all worth it. It's why we are who we are today. Amen. That's right. And I'm telling you, remember, cafeteria opened for us.
Yep.
The whole campus was sleeping, even on a Friday morning.
Yep. I only had time to get orange juice, but you had a full meal.
I had my breakfast. Listen, I had my breakfast. Then I took care of myself so that I can go take care of others.
Yep. I took a bagel with me and some orange juice.
So I have Lisa here on the Health Flow Podcast. And the reason I have her, our topic is lupus. And Lisa's going to tell you just how she was diagnosed. And that's where we're going to start. So Lisa, tell us about you being diagnosed with lupus.
Well, believe it or not, it is 40 years, January this month, that I've been on this lupus journey.
Right.
I went in the hospital for the first time in December 26, 1979.
Wow.
And when I was discharged, it was January 80. My parents knew that I had lupus, but I did not.
So this is all going back to high school then.
Right. I was a sophomore in high school. And I just had some joint pain in my knees In the morning when I would get up, my feet would hurt really bad. My joints and my hands would hurt. But by lunchtime, it would all go away. So I would kind of forget about it.
Right.
And then as time went on and practices went on, I thought it was from cheerleading practice.
Right.
And then I remember just being really, really fatigued. Like I could just make it home from practice and sometimes just go straight to bed without dinner, without anything. Just really, really, really tired. And it just came, noon would come and it wouldn't go away as fast and it would take longer. And I believe it was around November that I finally said something to my mom and said, I don't think I feel good. Didn't put together that I was having sores in my nose and in my mouth. Um, they told me that by the time I was admitted, I was having fevers, unexplained fevers. And what for my family, what was part of the blessing is that my mother's sister, my maternal aunt, had been diagnosed with lupus 3 years prior to me.
Mm-hmm.
So because she was diagnosed prior to me, I was tested for lupus right away.
Okay.
So that's why they knew pretty much. It's after my first visit, my mother said that he was pretty sure that I had lupus. I didn't know until I said I was discharged late December. I mean, I went in December. I was discharged late January.
Mm-hmm.
And at that point, we were still waiting for the bone marrow aspiration test to come back that would confirm a lupus diagnosis.
Right.
And it just occurred to me at dinner one night that no one had come to me and said, "Oh, Lisa, we got your test back. You don't have lupus."
Mm-hmm.
And I just like, oh, wow, you know what? Nobody said anything. So I just said, we were at dinner and I just said, I have it, don't I? And the room got really, really, really quiet. And that's when they said, yeah, you do have lupus.
Mm-hmm.
And I'll tell you, initially it was very daunting because all I had to associate with was my mother's sister who had one of the worst cases of lupus at that time.
Right.
She was in all the books and she had kidney failure. And I remember what her shunts looked like. And she lost all her beautiful hair and she was in and out of hospitals and doctors. So that's the only thing I had to associate with. So in my mind, I know I don't have what she has. They can say what they want, but I don't have what she has.
Right.
And I remember just saying that. And I remember that Christmas that she came up to the house and she was telling me some of the things that she does to help. And I distinctly remember saying in my head, I don't know why you're telling me that because I don't have what you have. and, but here I am 40 years later, and our original prognosis was 10 years. She was diagnosed when she was 18, and she lost her battle to lupus when she was exactly 28.
Right.
I was diagnosed when I was 15, which would have gave me my prognosis at 25. And on Thursday, February 6th, I turned 56. So I beat them over and over again, over again.
Oh my goodness.
Yes.
Think back. And then you, so this is in high school, then you come to college. So you come knowing that you have lupus, but that's not how we met you. We didn't
Yeah,
meet.
what happened was I was supposed to start that September with everybody. September, so it would have been September
82.
82.
Mm-hmm.
And I had my first bilateral hip replacements in July of 82.
Wow.
And I kept saying, I'm going to do it. I'm starting with everybody else. I'm going to go. I'm going to go. And it took me until the day before school started. And my mother kept saying, how are you going to manage with 2 crutches and a new campus and you don't know anybody and getting from class to class? I don't know if you remember my best friend then was Andrea Caldwell Moulton, but she was a senior. And I was like, oh, Anne's there. She'll take care of me. You know, I'll meet people. And it was the night before that I finally like said, I think I might be biting off more than I can chew here.
Yeah.
So I started in January.
Okay.
So
Of
um, so that's why I didn't live in
the
um,
world that we lived in.
the dorm, right? I ended up being in what was then West Res because I couldn't live with multiple people. And I had to have all of these like stipulations because lupus is an autoimmune disease.
Yes.
So what actually happens is our body has an immune system that's supposed to kick in and fight or go to war for us when we have a bacteria or infection or something like that.
Right.
In lupus patients, our body doesn't know that we're not in a war, so it attacks ourselves. It attacks our own body. So our bodies are constantly in a fight against itself. And that can be anywhere from the brain, the heart, the kidneys, the skin, the lungs, the blood, every part. And that's what we call SLE, Systemic Lupus Erythematosus, or SLE lupus. And that's what most lupus patients are diagnosed as. There are actually 3 types of lupus or 4 types of lupus. There's cutaneous lupus, and those patients are pretty much have the dermatologic or the skin part of it, which is usually exacerbated by the sun.
Right.
And then there's neonatal induced lupus, and that's rare. But if a mother is pregnant and has a baby, and the baby needs blood transfusion, we know that a baby doesn't develop its own blood system for about 6-7 weeks. So it has the mother's blood system. So for that 6-7 weeks while a baby is developing its own blood system, lupus or it's the baby's body attacks itself. But usually that will go away. The only sometimes those babies have some congenital heart issues. And then there's medication-induced lupus, and some medications will induce a lupus-like syndrome, and usually that's cured by just stopping the medication.
Right.
The primary symptoms of lupus, I would say most part is joint disease, joint painness, and that can be anything from swelling, stiffness, achiness, or what they call arthralgia. And the difference between arthritis and arthralgia is when the joints swell and are stiff, but they don't lose their shape. When the swelling goes away, your hands or your feet or whatever will go back to looking normal. As in arthritis, the joints actually change.
Right.
Then there's the fatigue. All lupus patients complain about the fatigue, and that's not the same as being tired. That's not that I worked all day or I've been really busy and I'm tired. No, this is an overwhelming, I just can't do it. I have to take a nap. I can't get up today. Then there's the kidneys are very much affected by lupus. Most long-term lupus patients will have some type of kidney changes. Not necessarily, it doesn't necessarily mean that it's life-threatening, but some changes. Lupus is very different for every patient. There's no 2 lupus patients that have the same exact pattern.
Right. I wanted to back up a little bit because we did say 4 types of lupus. So we said cutaneous, neonatal, medication-induced, and also discoid.
Well, discoid is a cutaneous.
Yeah.
So the first one is systemic lupus,
right.
SLE.
Okay, so it's systemic. I knew there was 4. So they call it subacute cutaneous lupus erythematosus. Yes. Okay. So, and that's also discoid.
Discoid. That's also discoid. Correct.
Systemic. So yours is definitely the systemic kind.
Yes.
And yours specifically attack your bones.
Correct.
If that's
The
how it.
issue with lupus is there's not many. There's no cure for lupus. Um, as years have come and gone, treatments are getting better, has gotten better, and are getting better. But oftentimes you have to weigh the risk and the benefit
Mhm.
of treatments. And in my case, we had to risk the benefit and the risk of steroid therapy.
Right.
For me, my lupus only would respond to prednisone or high dose steroids.
Mhm.
The problem with that is I developed avascular necrosis of my major bones, which is called avascular because or aseptic necrosis because my bones didn't break down because of any infection or any trauma,
Right.
but directly related to the steroid treatment.
Treatment.
So it was either this high dose steroids to control it or nothing.
Right.
So I spent years on high dose steroids, as much as 1,500 milligrams a day IV.
Mhm.
And I was started on oral steroids almost immediately that January of 80. And by that September of 80, I had already started to have hip pain.
Mhm.
So they knew that avascular necrosis was going to be an issue with me. But
Right.
back then we didn't have anything else.
Right.
So we had to just have it. So to date, my first hip replacement was July 1982, and they did both at the same time.
Mhm.
And that was because they wanted them to heal at the same time because of the chance of infection. So they wanted them to heal at the same time. And they told us from the beginning that I would outlive my hips, that the average, they can't tell you how long they're going to last, but the average has been anywhere from 10, the shortest has been 8 years, the longest have been like 12 years. So you have to have them replaced. So each side has been replaced 3 times. So technically, I've had 6 hip replacements. My shoulders, both shoulders have been replaced. Two on two on the left, two on the right, and one on the left. And actually, I am due for my second one on the left. It's not even. I can't even reach up to the sky with it. I can't. It's very non-usable. Um, it's very immobile right now.
Mhm.
And the surgeon already said there's nothing to do but to replace it. And then I've had my left knee replaced.
Mhm.
So yes, my sister calls me Jamie Summers. And that doesn't account for the acute renal failure episodes, the pulmonary embolisms. It's just been lupus patients go through periods of rest and flares.
Mhm.
We'll call a flare when a disease becomes more active. It's called a flare. And anything can cause a flare from your environment, your stress level, a medication, or just that your body just goes into a flare.
Right.
And each one is different. It's a different place. Usually, it's always a different place.
Mhm.
So most lupus patients have the rheumatologist is the type of doctor that manages lupus.
Right.
But then most lupus patients have a kidney doctor, a cardiologist, a heart doctor, um, a hematologist, a blood doctor. We have everybody. We have a specialist in everything.
Yeah. I wanted to go back a little bit because one of the things that I always remembered with you and us being in when we started out in nursing school together was that it changed your career path.
Yes.
Nursing. I just remember having that conversation. It came up because what happened is that when you're in nursing school, we get we go to all of the different specialties. But then
Mm-hmm.
as graduation is coming up, you start thinking of
what area you would like to
Mm-hmm.
specialize or work in. And talk about that, because remember I remember that specifically. I
Yes,
remember
that
multiple
was
conversations.
interesting. We had to learn how to do self-breast exams,
Hmm.
and we had to practice on each other.
Hmm.
And Jean was my partner, and we discovered a lump, or what we thought was a lump. And we went running to the professor, and she felt it and said, yeah, this is something that needs to be checked out. And we were like, oh my God, and da 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 da. And it turned out to be nothing, but it did cause that professor to bring me in and talk about my choices.
Hmm.
And this was our junior year. And
That's your
actually, she ended up, it was your senior, my junior. Well, we're a semester apart,
hmm
but you were ahead of me. And her suggestion was that I give up nursing and go into social work.
They were always trying to get us to give up something.
And that wasn't about to happen. That was not going to happen. And I'm like, my junior year, you're going to wait to tell me that you don't think I should be a nurse. And what compounded it is right after that, we had to take pediatrics. And she was over peds, and she didn't want me to take pediatric clinical. But you can't get through nursing school if you don't take pediatric clinical.
And now
So,
that you say that, I remember pediatric clinical is very dangerous because I got sick. I actually got chicken pox doing my pediatric rotation and had to go home.
and you did pediatrics a semester before me. So I
Right.
don't know if she was thinking about you, but she did not want me to take pediatric clinical. And her thing was that I could catch something from one of the kids. Long story short, I had to end up signing an agreement with the school, with the university, and with the hospital that I would not bring suit if I caught an infection. And
Mm.
that was the only way that I was able to continue the program. And then once I graduated, it was a big thing, a matter of what part of nursing could I participate in? Because I originally well, I always knew I wanted to be an OB, and God just opened that door. I knew I was meant to be a labor and delivery nurse because my senior year, I got a job in the labor and delivery
Department.
at the hospital in labor and delivery as a nursing assistant. And they ended up keeping me on. And from that point, and you never get into labor and delivery unless somebody dies or retires.
Right.
And I went straight into labor and delivery.
Mhm.
And I spent my career, my 20 plus career doing labor and delivery and maternal child health.
Uh-huh.
And that almost never happens. So that it was very, and there were some other areas I could do labor and delivery. I could do the OB. I had to do what they called clean units. So
Right.
I could do the OR, but the problem with OR was I couldn't stand all day. I couldn't stand for long stints because of my hips. So I was very limited. Um, but that was one of the reasons why I chose a BSN program because my psychologist at the time she was a nurse, and she encouraged me. And I have to thank Jackie Walker. I have to thank her because she fought for me with the doctors, with the university, and explained to them that just because I had lupus did not mean I wouldn't make a great nurse. Not a good nurse, but a great nurse. And
Wow.
as she put it, is that there were things that I would be able to do administration wise, that I would not need to be in contact with patients had I not gone the BSN route. So, and then I had people like you who supported me. There were several times when I got sick and needed to go to the hospital in the middle of the night because I had a fever. I would get these fevers of 102, 103, And I knew I had to go to the emergency room, and there weren't many people on campus with a car. But Jean was one of my angels, and she would take me in the middle of the night to the hospital. And yeah, that was a glorious day graduating, because there was a lot of people who didn't think that
Good.
hill I would be able to climb,
Yeah.
including my physician. I found out years later that my doctors and my family did not think that I would complete Seton Hall's nursing program, but they wanted me to figure it out on my own. Well, I'm still trying to figure it out, because I never figured it out.
Mm-hmm.
And not only did I complete the program at Seton Hall undergrad, but I also completed Seton Hall Law School, where I had received my MSJ, or Master of Science Jurisprudence, in healthcare law. And the reason for that was to help change some of these healthcare laws, to help people with chronic illnesses. I tell you, when you have a chronic illness, it becomes a full-time job.
Mm-hmm.
And the laws are not set up for the everyday person. And if I had not had the knowledge and the wherewithal and the background, I don't know what I've done, because I don't know what people do who don't have the background knowledge.
Right.
When you're dealing with the insurance company, or even the doctors on an intimate basis, like every day. It's today, Saturday, and I spent 2 hours on the phone with the insurance company today.
Mm-hmm. It's a constant battle. Constant. But Lisa, look, you're the one that I thought motivated so many of us, because it was your strength. We weren't waking up every day in pain. Do you know what I mean? We
Yeah, there was
weren't.
days where my hands would be swollen, or my feet
Yes,
would be
but
swollen,
you still put
and
forward your beliefs, your hard work, your determination. I mean, we had to do it because
we
you
had to
were
do
doing
it. There was no shortcuts. There was
it.
no, you had to do it.
It was amazing. So I've always, looked up to you as a source of inspiration, because here's something that you're dealing with day in and day out. And you were always still so upbeat, so motivated, no matter what. So you're an inspiration. You beat this thing. I mean, 10 years, they gave you 10 years to live.
Yeah.
You've had so many different procedures, surgical
So
procedures,
many to so many
that,
to name, so many
that
to
an
name.
infection of any sort, just an infection alone could have taken you out. But
And I've had general sepsis at least 3 times, where I've been in ICU, and I would wonder, why are my parents coming up in the middle of the night? Why are they coming to see me anytime they want to? And it wasn't until a lot of stuff they kept from me. Back then they didn't tell the kids much. And I was always still considered a teenager.
right.
So they told my parents a lot of information. I remember my first admission, and I heard the admitting secretary say, I need a bed for a 15-year-old Black female, possible lupus. And I remember jumping and looking at my parents and saying, she said lupus. She said lupus. I don't have lupus. And I remember my parents looking at each other like, oh my God. And my mother, and my mother just said, "Oh, we had to use that for the insurance." And I went, "Oh, okay." And and I was just going about my way. Oh, okay. So they would call and ask to speak to my parents, and I say, "Oh, it's about me. You could tell me." And they say, "Oh no, we wait till your mother get home. Or your father get home." And I have to give it to my dad, who once I did find out that I did positively have lupus. He researched out the Lupus Foundation, the New Jersey Lupus Foundation, and he made the appointment for my first meeting with a woman who had lupus. And at the time, I was being seen by an internist, or primary doctor.
Mm-hmm.
And she said, no, I have a rheumatologist and she's a female and I'm going to refer you to her. And that's Dr. Phoebe Cray from University of Medicine and Dentistry. She was the director of rheumatology all my years until she retired. And in addition to just God's mercy, she kept me alive.
Wow.
She kept me alive. I never even knew what a primary doctor was until she retired because she took care of everything.
Yeah.
She wrote all the letters to Seton Hall. You know, I remember she had to write a letter to my biology teacher because they didn't, for some reason, they didn't want me to take biology, and she had to write a letter that I was okay to take biology, and it was always, anytime you mentioned I had lupus, everybody put up the flags and was like, oh, wait a minute, she
Mm-hmm.
can't do this. And if it wasn't for people like her and the Lupus Foundation,
Mm-hmm.
I would have gone through more hassle. I still would have done it, I think, because
Right.
I knew since I was in the third grade that I was going to be in medicine. But I knew since I was in the sixth grade that I wanted to be an OB, and I
Mm-hmm.
wasn't going to stop until I did it.
And you did it. And you've survived over and over again. And yours is a story that needs to be told because,
Nursing for me was not a job, it was my mission. It was
yeah.
my calling, it was my ministry.
Mm-hmm.
It wasn't a job.
Yeah. You loved OB. I did not.
I remember.
I
You
mean,
either love it or you don't.
I did not because I didn't like to. Back then, I think it was because of where I did OB. I did it at St. Joseph with
Yeah, we did say
a lot of
Joe.
screaming women. And I'm not even going to say what their nationalities or anything were, but that never changed me. I'm like, how am it can't be that bad. I remember saying, it cannot. I'm talking about, you remember?
Yes, absolutely.
Hysterical women.
I remember
Hysterical.
exactly. I
So
remember
then
going
I
to
was like,
St.
oh
Joe's. Yeah.
no,
And
why
I
would
loved it.
I?
And I loved it. I thought it was so exciting.
I
I
did,
loved it.
I did not. I was like, no way. This is scaring the life out of me.
I
You know,
wish I
having,
could tell you how many births I've assisted in or been at. I can't remember, hundreds and hundreds. And every one of them to me still makes me go, oh.
yeah. I wanted no parts of it. I really didn't. It was beautiful. It was life changing. But I couldn't get over the screaming in the because of it was the setting. I'm not even gonna, like I said, I'm not even gonna say the type of people that it were, but some of it was overwhelming for me as a young student. And
Mm-hmm.
like, I love everything else in
I
nursing,
don't
but
think nobody, I don't think any of our classmates loved it as much as I did. I don't think anybody.
well, you were born for it. And that was, God knew what he was doing because that's your sterile area that you
It's a
needed.
sterile area that I needed to be in. And, you know, I still have patients that, you know, babies that I helped deliver, and we still keep in touch. And now those babies are 30 and plus years old, and I can't even believe it.
Yeah, yeah. So yeah, I definitely wanted you to have the opportunity to share and tell your story. It's a real life story you've struggled with. And I don't even want to use the word struggle. You've championed, you've just been like, you've kicked lupus in the butt over and over again.
Well, thank
Uh,
you. It doesn't always feel like that. It does
but
not
you
always feel
do it.
like that.
You do
One
it.
of the other things that most lupus patients don't talk about is the depression. And
Yes.
depression and anxiety is a huge, huge um, symptom.
Right.
Most patients do have some sort of clinical depression, as I do. But just like in any other, with any other diagnosis, you have to have a doctor that you trust.
Hmm.
You have to take medication,
Yeah.
and you know you fight through it like any other symptom. But
Right.
it's always it's always there,
Yeah.
in the good times and the bad times.
Right.
Like I said, there's flares, and I went through like I'm gonna say a 7-year period where I had almost no symptoms, like just a regular joint stiffness or a little thing here or there, but no major, surgery or, no major. And then I had a flare, and that was in the 90s, and it has not stopped since.
Wow.
I have not stopped since. It's been one thing after another. And it's challenging. It's challenging on my family. The other issue is caregivers. Your caregivers. You have to have with every lupus patient, you have to have caregivers. My parents, my family, my husband. It's challenging for them. It's wearing on them.
Yeah.
Just the worry, the physical, there's times when I can't walk and, I can't do things for myself. And it's hard. It's hard. It's
Yeah.
like, it's a job. It's a job. I remember my husband saying one time that he felt like he had two jobs. He would go to work and then on his way home, he'd say, now I'm going home to my second job.
Right.
So it is. And then the finances, I
The health.
went to school and, have to pay all that money to go to school. And I'm sometimes haunted, I feel, that I'm not doing what I went to school for. I thought I'd be delivering and being labor and delivery until I retired.
Right.
And I've had to change that. So, that's hard. But what going to school and watching people like you and doing this podcast teaches me that there are still things that I can do
Yes.
that are meaningful.
Yeah.
And I just have to be more active about searching those things out
Yeah.
and be more proactive. I would encourage anybody that has lupus to look into. Every state pretty much has a lupus foundation. I'm a member of the Philadelphia Lupus Foundation. In Washington, D.C. is the Lupus Foundation of America, LFA. And they have tons and tons of information, all of the research that is going on. There's some new drugs, actually one that I've participated in, and that was a really good drug for me. We had to stop it because it falls under the realm of chemo drugs, and because of the long-term attack on my veins, it was hard for them to find access every month. And sometimes it was harder to find access than it was to take longer for the access than it would for the actual medicine.
Right.
So we've given that a break for now, but Benlysta worked really well for me. And then other patients took, I think there's another drug, and I did horrible on that. So, you have to, be willing to try some of the new drugs under supervision. And usually all of your national or your local lupus foundations will be able to help you with that. May is National Lupus Awareness Month, and that's coming up real, real soon. And you'll find all kinds of walks and fundraisers. Now, our national primary fundraiser is the last October and the last Sunday in every October, and that's the Lupus Loop. I don't know if you remember, I did the Loop for Lisa one year.
Yes, you did.
And that's still our major fundraiser. And then there's the Lupus, there's a Alliance Research, and they're right now, the Lupus Alliance Research, they're doing the most innovative and funding for lupus research. Like I said, there's no cure. Most lupus patients are either African American or Native American descent. And usually the onset of lupus is with dementia, so somewhere between 13 and 45 during a woman's childbearing ages.
Mm-hmm.
90% of patients are female, 10% patients are men. And then there's a small amount of lupus patients that are diagnosed in their senior years.
Mm-hmm.
And that's a small amount. We do know that there's a genetic component.
Yes.
As in my family, my mother's sister had it.
Mm-hmm.
But that's not exact. We just know that there's some genetic component, but that's not found in every family. We know there's an environmental component. We know that sometimes infections can bring it on.
Right.
I've seen people who didn't have lupus until after they had their first baby, and
Right.
the stress and having their first baby brought
Mm.
out the lupus.
Right.
Um,
I
so
just
it's a lot. Actually, people don't know this, but more people have lupus than cystic fibrosis,
mm-hmm.
MS, fibromyalgia, and AIDS.
Yeah. Wow. Yeah, lupus is real, and we don't, especially in the African American community, and we're the ones that's so heavily affected by it, and we're not talking about it.
We're not talking
We're
about it.
not
We're not
talking about it.
supporting it.
Yes. I mean, yes, it may be discoid, or just of your skin, but lupus is lupus, so we need to be aware. And that's why I wanted you to share your story. And no matter what, I wanted to go back to something you said, because no matter what the ailments, whenever you're dealing with chronic illness of any kind,
Any
okay?
kind.
Any kind of chronic illness, that takes you out of your normal realm.
Yes.
It alters your lifestyle.
Agreed.
And with that alteration in the lifestyle of doing things that you normally would, depression can come in.
Yes.
That's when the mental health piece. And what I like is the fact that you started seeing someone for mental health
When I
upon
was 17.
diagnosis of
Mm-hmm.
which I have to commend your family and parents for, because lots of times, especially in our community, we don't see the importance of that. And that helped you deal with it. And I think that was a strength move. Another thing is you were on prednisone. We know mentally, people talk about steroids and what they do to your bones, to your mind. Steroids can make you absolutely feel like you're going to lose your
Gonna lose
mind,
your mind
you
or
know,
take somebody else's.
or
Yes.
take somebody
And
else's.
I've been on steroids now for 40 years nonstop. I have never come off of
You've
prednisone
only
since January 1980.
Yes, you've only been on low doses, and then when you have your flare up, you're back up to the highest. So there's a lot of components to that. So you can't say you have a chronic illness and not have mental health as a piece, as a part to help
Can
you.
you imagine losing all your hair in high school? One year you're a cheerleader, you're jumping around, you're doing this, and then you come back the next season and you don't have any hair.
Right.
Like, what does that do to you mentally?
Psychic, yeah. So I just think that, we always have to be mindful for that. And that's something as African Americans that we lack, taking care of our mental health. And I hope, the stigma that goes with that, it just needs to go away. You just need to get your help, work it out. You can't deal with it all on yourself. And just the stressors that we're under that leads to some of these illness anyway.
Mm-hmm. Anyway, now
Women.
I have to admit, I did not go to the psychologist willingly.
Of course not.
I did not go. I was tricked into going.
Mm-hmm.
I will stick to that story. That's my story, and I'm sticking to it. My parents and my doctor had already decided that I needed to. My first major surgery was coming, and they thought that it would be helpful. During that time, my parents were going through a divorce, so they all felt that the psychologist was going to be beneficial. Well, they
Right.
didn't tell me about this. So this woman calls me and tells me who she is and invites me to come to this lupus group of other teenagers that had lupus. And I said, absolutely not.
Mm-hmm.
And she asked me why, and I said, I'm not going to a group sharing and comparing my ups and downs and pain and stuff. No, I'm not going to do that.
Mm-hmm.
And she said, well, would you see me by myself? Okay. I thought I was going for one visit
Uh,
until the end of the visit. And she said, well, for the first 6 weeks, we'll concentrate. First 6 weeks? What do you mean? I have to come back?
right. Right.
And, I was flabbergasted that they thought I even needed, because I thought I was handling it very well.
Mhm.
And I didn't think I needed it. But that same psychologist I am in touch with today, from the time I was 17 to the time I'm 56. And
Right.
she has been with me through every hump, challenge, adversity, good time. It even changes who you date, what
Right.
schools you go to, who you date, who your friends are or
Right.
aren't.
Right.
It affects every part of you,
It
every
really,
part of you.
yes, yes. Our time is coming near, and we do have to end. But and this, I mean, we obviously need more time because I feel like you haven't even touched. You only touch the surface of all the things you've been going through all these years, and maybe we'll have a part two. Let's see. One thing, this is for you. I mean, this is powerful what you've been going through, and you know what I've been encouraging you to do is
Yes,
to
I do.
write that book. That's what I need you to do. That's the other job you could be doing right now. Every day. I told, even if you don't physically type or write, you're an excellent storyteller. Your memory is sharp and bright. I need you to put all of, record it, get it out, then have someone transcribe it. Then you send it to the publisher. It's a story that needs to be told. You're a wealth of information. You're knowledgeable. You've lived this for 40 plus years, right?
Yes,
It's
ma'am.
a story.
Well, you're not the first, and I'm sure you won't be the last.
Well, I'm hoping I'm the last so that you can do it. Okay, Lisa? Thank
Yes,
you so much. We have to continue this conversation.
yes, we will.
It's about informing people, inspiring people, educating them, letting them know they're not alone, and this is something real, and it doesn't have to be. No one has a last say in your life.
Right, exactly.
You've always been a fighter from the first day I ever met you. No matter, you took everything in stride and you kept on moving. You've inspired me as I've watched you and just see all the struggles you've gone through, and you win every time.
He
You
wins every time. He wins every
God
time.
wins every time. Yeah, you're right. You're right. So you're a child of God, and I love you, sister
I
girl.
love you, and thank you so much for this forum. We
Oh,
needed it.
welcome. You're welcome. I hope it meant something to everybody, and I hope you got something out of it too.
Yes, I did. I did. I did.
Awesome.
It was cathartic.
Excellent. Excellent. We'll have to keep it going. Thank you
Okay.
on the health
Love you.
podcast. Thank you for listening to the Health Flow podcast. Your support is much appreciated. It is my goal to share health information that you find helpful. Email topics of interest to thehealthflow@gmail.com. Follow me on Instagram at thehealthflow, also on Facebook at The Health Flow. Don't forget to subscribe, rate, and share. Until next time, keep your health flowing.